Hello, my name is Suzanne Young, and I am the program coordinator with the community care program at Prisma Health. My role is to run the day-to-day operations of this program, so I'm involved in all the different aspects, from the referrals to volunteer recruitment to building partners in the community and the ongoing process of running this program. We applied for funding from the Duke Endowment for this program when we recognized there was a need in the community for patients who are chronically ill, who after discharge do not have a support system at home to provide them help with practical things, with emotional things, and that, as we know, affects your overall health. And so there was a high rate of readmission to the hospital. And so the idea of this program is to address those practical and social and even spiritual needs to help improve the overall health and quality of living for these patients, so that there will be a decrease in the hospital readmissions and trips to the ER. Our patients come to us through a variety of sources, where it could be in the hospital with a social worker or a nurse case manager can refer to us. We also get referrals from different programs in the hospital. We also have connections with community paramedics and with some satellite offices as well. So I do trainings all the time with anybody who comes in contact with patients who would be eligible for our program. And the only thing is, you can't self-refer to our program. A staff person does have to refer you. To be eligible for our program, a person has to meet 2 of 4 criteria, and that is chronically ill, underinsured or uninsured, a LACE score of 59 or higher, which is something that the computer generates for people when they're in the hospital. And then also, they cannot be classified as homebound officially. And if they meet any of those 2 criteria, then they are, and 18 and older, they have to be 18 and older, then they're eligible for our program. After a result of COVID happening last year, our program became very important as a way to deal with social isolation, which so many people were dealing with, especially the elderly, which is a lot of our patients. And so we are able to provide that connection. People enjoy having someone just listen to them and call and check on them, or send them a card, or bring them a meal. A lot of our folks live alone and they do have chronic health issues, so simple tasks like housework or cutting the grass is just not possible for them. And if they don't have family support or neighbors that are willing to help, then our program helps meet that need through our volunteers. This program is completely free for the patients. All we have are volunteers that work with this, and then we have 3 staff, and that's it. So it's a very easy program to access and receive services for. And you can be in our program for up to a year.
My name is Alex. I'm a nurse case manager here at Prisma Health Hillcrest. We kind of do a variety of what I call behind the scenes type things, but one of our biggest roles is assisting with discharge planning, whether a patient needs to go home with home health, short-term rehab, transportation needs, home IV antibiotics, community care volunteers, whatever. You know, we do all types of referrals for things for patients leaving the inpatient setting. So my role with connecting patients to the community care program is we perform what we call an adult assessment for all of our patients, and we kind of start by picking apart needs. Who do they live with? Do they live alone? We kind of ask them questions. Are you able to take care of yourself? And so forth. And as they kind of tell us their struggles or non-struggles, if we feel that a patient might be a good candidate for the community care program, we'll kind of briefly educate them on this service, if it's within area, or if we feel it's appropriate or they meet the criteria. A lot of times patients are very open to it, and at that point I will reach out to the program and put the referral process online. I feel that a reminder at discharge, at kind of like an in summary conversation, is very helpful. I think that being admitted is extremely overwhelming. They get a lot of different information from a lot of different services. I always try to provide a case management home care needs form, and if I've made a referral to the program, I try to have that listed on that form. A lot of times I will assess and prepare for a discharge for one day, and they might not discharge for 3 or 4 more days. So I think that a follow-up summary of the referrals that I've made are very helpful for patients. They always have my contact number to some degree, or the family will, and if they do have a need or a question, I let them know, you can call me and I may or may not be able to help you or re-refer, but I might be able to get you in the right direction. So I like them to have that option, but sometimes once they're discharged from the inpatient side, it can be a little bit difficult, but a lot of times I can at least point them in the right, with the right contacts. I have had one patient that was actually a great candidate. She had a condition where she couldn't leave her home, and she came back to us for a brief readmission, and she had mentioned to me that she was very happy with the services, and I think a lot of hers was just friendship and companionship, which she's a very social person, so she was really excited to kind of have that buddy system, as she calls it. She's like, oh, I've made so many friends, and I think that was really helpful for her. I definitely think the volunteer program improves the quality of life for patients following discharge from an inpatient stay. I think that the medical needs that we are able to meet with home health and new prescriptions and rehab, I think that's very important, but everyday stressors that patients and families express to me, which would include short errands, picking up prescriptions, help with pet care, those simple things. If they are not met, the patient they seem to be more, stressed, and all the good medical care in the world. If you're still stressed about those things, the quality of life is just not going to be totally met. So I think that it's extremely important to have those services to help people when they are home from an admission. I absolutely am seeing a trend in more and more needs for these type of services. A lot of our patients, again, we treat them medically. We're very good at that here, but sometimes we are starting to see more and more widowed patients. Patients live longer with different comorbidities where they're not able to leave the house, but in this service kind of allows them to stay at home with some assistance for some very basic needs that are very important to them. And we're seeing a lot of that, especially in this area, as it continues to grow. I'm very excited about this program. I like to present it to patients. I like to see them get excited. One of my most successful discharges is when I can give them a good list of services that they will receive at home. And I like to feel that they feel comfortable and safe going home. So I think that the volunteer services kind of adds that little bit of just that safety net, and I think that they feel more comfortable discharging after some admissions.
The scope of our volunteer services is non-medical tasks, so we don't do anything that has anything to do with medicine, even if it's just putting pills in a bottle. Our volunteers are not allowed to do anything like that. They strictly focus on practical, such as housework, meal prep, yard work. They can walk a dog, they can do all those kind of things. They can help with transportation, and they can do emotional, whether it's a phone call or just a visit, send in a card.